I'm in the midst of exploring what's the best option for me. And one of the things that I find helpful is that, well, a couple things I find helpful that there are trainings available sponsored by NIH, National Institutes of Health, National Cancer Institute. It's also helpful that I have a mentor that's willing to expose me and take me along on a journey to figure out the best method, and also talking to colleagues that are also trying to figure out their next steps in their careers. And I think in these three buckets, these three avenues is where I'm going to get the answers to my questions. These trainings do help you design for dissemination. I feel like once I completed the sprint training with our research group, all of a sudden I heard about um, dissemination and implementation and other cohorts that NCI and NIH are running to help people think about dissemination and implementation. Didn't occur to me before. I knew I wanted to do that, but I didn't realize that there were structured pathways or fundable pathways to get it done, or areas that were people willing to invest in you in terms of like effort or money for you to go and have this training related to dissemination and implementation. So as a result of the sprint cohort, my involvement in the sprint program, the trainings also allowed me to, again, with this networking piece, bouncing ideas off of other people about, does this work? Does this not work? I've also, with the training, had conversations with my research team and conversations with my mentor about what she is thinking about doing, or or what her next step is for her RO1. And just an opportunity to see her, follow her, and watch her thought pattern helped me figure out what I also would like to do. Sorry, the sprint training also helped me, prompted me to think about, what does scaling up actually mean for these primary care providers in these federal qualified healthcare clinics and for these patients? How do you scale up text messages? Does it mean it's text messages and something they receive while they're in clinic, like iPads or something, or education delivered multiple ways? So that's what this allowed me to see, that yes, everyone wants to scale up their intervention and commercialize it and disseminate it, but what does that actually look like? In order to figure out what that actually looks like, you have to talk to the people that find the value in it, and have them help direct what the scale up should be, especially for somebody like me that's very junior. And as a result of talking to patients and asking them what they would want or what they would think should accompany these text messages, I got an idea for the next step of my intervention. So the advice I would give to another junior person is to seek out these opportunities. So if there is something that's if there's low hanging fruit at a conference, like a pre-conference workshop, attend. If there is a actual conference session about dissemination implementation or about commercialization, even though it may not be within your content area, attend, because the methods are still there and the theories are still there and they're still applicable, and you can just tweak for your content area.